Hey everybody, my name is Dr. Daniel Choi here from North Texas Dental Surgery Wisdom Teeth and Denture Implant Center, and I want to talk about a topic that I love talking about. I love talking about complications, right? Like what can go wrong with your potential all-on-4 prosthesis. Although I consider myself to be an optimist at heart, I'm always kind of just always looking at like, hey, I'm gonna plan for the worst, hope for the best. Um, just really thinking about, hey, again, I am going to be an optimist about things, but I always want to be prepared about all the things that can go wrong when I'm investigating anything that I'm looking to purchase or looking for a solution for anything. So I'm sure, I'm 43 years old. I'm sure you guys have made the mistake that I have had many times in my life. Maybe when you were so excited to go and buy that first home or buy that car or maybe get a swimming pool for your backyard. And you're really like, just like eagerly looking for options and you just look to see who has the best price and then you go and buy it and you're like, start experiencing issues, whether like immediately or 5 years down the road, you start thinking, oh crap, maybe I should have really done my research. And my whole video and post I'm going to have today is going to really be about helping you guys be as informed as possible to make sure that you guys ask the best questions so that you guys don't experience like issues with your surgery or again start experiencing issues 5-10 years later down the road. One thing that I've seen also is I've seen patients who have been frustrated with other solutions that they've had before and they made a decision on price. And for example, they had a hybrid prosthesis or an acrylic prosthesis. They were bait and switched, and now they're like, oh man, I should have made a better investment. And sometimes not only do they make end up spending more money down the road, but they end up spending more money than they originally would have in the past had they made the most informed decision back in the day. So what I'm going to do is I actually created a little PowerPoint for you guys. I want to jump right into that. So again, we're going to be talking about all-on-4 complications. And so what I really want to basically get you guys in the mindset of is like, we have different, like two main types of classifications of complications. I want you to think of them as having complications on the day of surgery, day one, and like initial issues or having issues later on down the road, whether that's 6 months, a year, or 5 years or 10 years down the road. And then also what I want you guys to understand that a all-on-4 is essentially a prosthesis. Basically the bottom line is you see something in your mouth that you can chew with, that you got a beautiful smile and you got teeth to chew with. But then really there's two parts to it. Like there's the foundational aspect of it, which are the dental implants, and then there's the prosthetic part of it, which is the house. And so I tell people, with an all-on-4, we have the dental implants in your bone, and all patients will ever see when they smile are the gums and teeth, and obviously you're chewing with those. But I like to tell people here down in North Texas, I'm originally from Ohio. We didn't really have any, soil foundation issues. But when I moved here and I bought my first house, I realized that there could be issues with your foundation. So I really learned how important it is to really make sure that you have a really well-built foundation so that obviously your house doesn't have any issues. And so what I want you to think about is you can have foundational issues with your all-on-4, which are your dental implants and bone and gum, or you can have prosthetic issues, which is the gums and the teeth, right? So with my house analogy again, foundational issues, you can get piers placed to help fix the issues, or do some foundational work, or you can be talking about like framing issues. Do I have termite issues, roof issues? That's everything that we have above ground. So basically what I want to let you know again is I'm going to be breaking that into those two parts. Okay, so let's see here. Again, I was mentioning just right now, all-on-4 is like an entire home. The part we see are your teeth and gums. That's what we call the prosthesis. The part embedded in your bone is your dental implants, and that is akin to the foundation of your home. So this is a pier and beam foundation, right? So they have these vertical piers going down into the soil or the bedrock underneath, and that's like your dental implants. And your bone and gum would be like the soil or the bedrock. You want to make sure that you have a very solid foundation so that you don't have any issues with your home. right? And so this would be your home. Okay, so again, as anybody who owns a home or is familiar with any foundational issues or house issues, they can really break those things into two separate components, but they are all interrelated, right? And so again, same thing happens with your mouth. Okay, so let's talk about issues early on. So day of surgery complications. Obviously, what we require for all our patients is IV sedation. Number one, it helps us to properly sedate you so you go to sleep, you don't remember anything. You're most at ease, allows us to properly do our surgery with no stress. Also, in rare occasions, again, I do see a lot of elderly patients. We can basically, when we do our surgeries, we have you monitored, EKG, blood pressure, pulse oximeter. But what we do is, in the event that you do need any life-saving drugs or need quick access to your system, the IV allows us to do that. Now, another thing that is very important for us is that we do require a 3D scan. It really allows me to be able to notice any anatomical landmarks I can't see in a traditional traditional panoramic X-ray. I'm going to be able to see your nerves, your arteries, any abnormalities in your bone, which allows me to really properly plan your implant. So I just want to share with you this real quick. This is a patient that had severe periodontal disease and ended up doing an all-on-4. But this traditional panoramic X-ray, if your surgeon is attempting to do this procedure with you based only off of this, that's the first step that I need to tell you, first sign that I need to tell you that you're probably working with the wrong surgeon. We definitely do highly recommend that you work with a 3D scanner. Certain things that we're looking for were your nerves, sinuses, placement of implants, what's the dimensions of bone. I can properly plan your surgery versus trying to eyeball it when I'm going in and looking for any certain types of anatomical factors that are really going to be significant that I avoid during your surgery. Now this is what a 3D scan would look like, and what I do is allows me to basically look at the dimensions of your bone, be able to see where exactly your nerve is, also dealing with your sinus cavities. Really helps me to properly plan your surgery. Now let's talk about the foundational part that we were talking about, which again would be your dental implants in your bone. The day of the surgery, when we place your dental implants, they need to have at least 35 newtons of torque for your implants to have stability. That way we can actually load your prosthesis. So what we're talking about here is that we're actually placing these dental implants in your bone, and when we place them in the bone, they have to have a certain tightness essentially, so that we can actually put this prosthesis on your mouth that day, that we can actually secure it in place. Now let me give you a quick example. Let's say that whiteboard behind me over there. So obviously, ideally, I would love to get those in the studs, because if I can get them in the studs, then they're going to technically be tight enough for me to, put that whiteboard on there. Now, let's imagine that thing was like 200 pounds. If it wasn't 200, if it was 200 pounds and I just placed some screws in the drywall, we're not going to be able to support that white erase board back there. Then we're going to be like, okay, we need to have a certain amount of tightness. Well, we know that we're only going to be able to generate that tightness if we get into the studs in the wall, right? So essentially, it's the same thing, that on the day of the surgery, when we're placing those implants, you need to make sure that your surgeon needs to make sure that he's placing those dental implants so you have at least 35 newtons of torque on those dental implants. If he doesn't, and then he tries to place that prosthesis on there, then what essentially can happen is you're now putting something heavy on the wall back there that's not being supported. Again, you're now going to be only in drywall and trying to hang up a 200-pound painting. It's not going to work. So although you technically might walk out of the surgery that day, your dental implants can get loose and they can essentially work their way out and have infection and fall out. And that's what we call periimplantitis. So that's a very important aspect that we need to make sure that your implants have that. If your prosthesis is loaded without having that stability, your implants will fail, and you will see darkness develop around the implant. And this is typically what you would be seeing around a dental implant. Now, this is this example I actually pulled from a patient who had her implant placed at another dentist, and she was having issues with she was experiencing pain, knew something was wrong, and her dentist didn't really know what was going on based off these x-rays and told her to just keep on taking antibiotics and pain medication. But this patient's sister, who had actually been to dental school, was a dentist, and actually ended up telling her to go find somebody else, and that's how this patient saw me. But yeah, I'm just pulling this x-ray as a quick example. Let's see here. Implant failure can occur not only in the first few months, but later on down the road. It's imperative that your implants be placed properly to ensure your implants don't develop issues further down the road. And so one of those issues that we're talking about is something called peri-implantitis, where essentially an implant can get infected over the long haul. There's multiple causes of peri-implantitis, whether you're doing single implants or implant bridges or all on four. But it's important that you keep them clean. That's definitely one aspect of it. But properly placing your dental implants is another very key component of making sure that you don't develop issues later on down the road. Although you can get dental implants that aren't giving you issues in the first 3, 6 months, a year, you can start developing over the long haul if, for example, like this, you don't want to place an overly large implant in an area because there can be bone loss in the future. So long story short, you just, dental implants, you really just want to make sure that you're properly placing implants so that, the patient doesn't start experiencing issues later on down the road. So with bone loss issues, like, can we do anything about it? Well, if you do develop an infection around an implant, it can happen because either the prosthesis, for example, is allowing too much bacteria in the area and you're developing infections, and then your implant has peri-implantitis and you start experiencing bone loss. Well, then eventually, if you lose your implant, you're going to have issues with your prosthesis because now your foundation is shot. So, you can also experience implant failure too, because if you didn't properly place your implants in the right area, or basically an implant starts experiencing too much load, too many forces on a specific implant, then you can also lose your implant that way too. But in cases of infection, what's great is that we have something called a Lanap laser, which does a phenomenal job of destroying the bacteria that's causing that infection, and also in certain cases can even regenerate bone. I actually have a case that I saw a month ago. We placed an implant on him and he had a previous root canal on that site and he was experiencing bone. We did the Lanap laser on him and grew that bone back like magic. It was pretty amazing. I'm still always very surprised at what that Lanap laser can do for us. So anyways, yes, the Lanap laser can definitely be used to arrest further bone loss and build bone around the implant. Another issue, you want to make sure that it's not just your bone, but it's also your gums that come into play. I don't want to get into too many, and I don't want to make this video too long. I don't want to get into the complications and how to do this exactly, but this patient is experiencing recession around his multi-unit abutments. So not only is he experiencing recession, but he's also experiencing bone loss, which can be an issue for your dental implants. So what you want to do is you want to make sure you have enough keratinized gingiva, meaning the thick pink tissue around the multi-unit abutment to ensure long-term health around the implant. This will help prevent gum recession and bone loss around the abutment and implant. So that's just an aspect of the surgery that you need to make sure that the surgeon is placing the implant in the right area, and also make sure there's an adequate amount of keratinized gingiva around that area. I've seen some horrible things. Some surgeons are just cutting all those gums off and not realizing how essential that is for the long-term prognosis for the patient. So you really want, one piece of advice I really want to give you, make sure that you're working with someone who really is looking at the long-term longevity of your implant. You don't want to be working with a home builder that's worried about hey, you not having any issues in the first year that you have a warranty. You want to make sure that that guy is worried about what your home, that your children can be living in your home one day, inherit your home and live in your home one day. That's the type of builder you want to work with. It's essentially the same thing with an all-on-4, because patients might be happy on day one, but where are they going to be 6 months or 6 years from now, right? If you have an infection in many places in your mouth, especially from failed root canals, then you may be more prone to dental implant failure. All right, I don't want to speak too negatively about root canals, but I'll tell you honestly, one of my biggest frustrations when I'm placing dental implants in somebody's mouth is coming from failed root canals. Now, when we do a root canal, we're taking out the blood vessel and the nerve supply. So the nerve supply, if we take the nerve out of a tooth, you can't feel anything going on in that area. So what ends up happening is I see so many patients on literally even on a daily basis where patients have had root canals, they don't know anything's going wrong within their mouth, but I take an x-ray or a scan of their mouth and they have these monster infections that have developed. And I tell these patients, listen, you need to get that infection out of there as fast as possible. Well, what unfortunately, so what is the solution a lot of times is dental implants, but what's shocking is the level of infection that's there. Again, the patient doesn't feel it because they've had a root canal and they took the nerve out, but it's that the area gets so toxic in the bone that it literally can poison the bone for a future implant. So I've done thousands of implants over the years, the last 10 years of practice, and done tons of all-on-4 cases, and it's extremely frustrating because it is a very intensive, very extensive procedure. When you place a dental implant, a patient has tons of root canals, and if that bone that was affected then starts to compromise your dental implant. So not saying all root canals can cause issues for dental implants, but if we're ever going to see an issue with dental implant failure after a all-on-4 surgery, good Lord, a lot of the times most of the times it's actually due to root canal sites. And so what that really forces me to do is I'm trying to get your dental implants. Let me show you here on this to give you a specific example. I'm trying to get your dental implants to be in strategic locations, equidistant from each other, going as far back as possible, but to give me what we call the anterior posterior spread. But if I have all these failed root canals, a lot of bone loss going on in certain areas, that really limits my ability to place my implants where I want to. So I have seen from past cases that if you do have a lot of infected root canals, that can honestly be a contributory issue with potentially having a failed implant. Now, one thing I want to say real quick is that first 4 months after healing, which drives me crazy, there's a lot of all-on-4 centers that will try to put you in your final prosthesis a few days after your surgery, which is completely asinine to me. That's another thing I could talk about. Wanted to take a step back. I'm sure you might have seen this in other videos. When we take your teeth out, or maybe you're already missing your teeth, but we take your teeth out, imagine you have all your teeth, take your teeth out, we place your dental implants, and we put this prosthesis on that day. I want you to wear that for 4 or 5 months, because during that time, I need to make sure that your dental implants are healing properly. Not only do I need to make sure that your implants are healing properly, so that you're not going to have, I'm not going to have an implant with a lot of bone loss, or that's going to be a failed implant that I'm going to put your final prosthesis on, but your bone and gum are changing shape significantly over that period of time. So I wait that period of time before I then take impressions for your final prosthesis. Again, what you're walking home with day one is not your final prosthesis. Your final prosthesis, at least with our center, is going to be a zirconia prosthesis, which is beautiful, very resistant, it's not going to fracture, all these great things about it. But what we have to do is make sure that I'm building a foundation for your life. I need to make sure that those implants are looking good 4 or 5 months down the road after the surgery, not experiencing bone loss, not having issues, not developing these large radiolucencies around your implant that I know are going to be an issue in the future. I don't want to build your house on a foundation that is compromised from the beginning. I had a house built 5 years ago, and I remember the day they poured the foundation, I went out to the work site that day, and I literally was inspecting over the whole foundation, trying to see that there was no cracks or any deficiencies, voids, anything like that. That's just the type of person I am. You want to make sure that you're working with somebody like that to really make sure that you're not going to develop any long-term foundation issues, because if it's having issues right from the beginning, your house is, in my opinion, just going to be compromised in the future. So getting back to the point, yes, root canals, failed root canals can be an issue with potentially causing dental implant failure, so we will definitely want to avoid that. Your dental implants are the foundation for your prosthesis. If your implant fails, it could compromise your entire prosthesis if the implant that failed is in a critical position. One way to avoid that is redundancy. So they call it the all-on-X procedure. Now, the all-on-4 was coined by the implant company Nobel. Some surgeons will call it all-on-X because for every patient that I see, I might have a 60-year-old male, big guy, that I might say, you know what, when I take a look inside your mouth, previous failed root canals, or you're just a big guy and I'm assuming that you're going to be biting with a lot of force, it might make sense to place 6 implants on you versus 4 implants on somebody else. So every case is different, right? And so one thing about those implants too is that more implants can also offer redundancies. So if you were to lose an implant, is it as critical if you have 5 supporting implants left. Well, one of the problems though is that if you lose an implant that was in a critical position, like for example, it was their furthest back implant, then that could be an issue, right? So every case is a case by case basis. So again, you want to make sure that you're working with a surgeon that knows a lot about what potential complications could exist. Long-term issues with implants can also be avoided if the patient does a good job cleaning their prosthesis. It's important that the prosthesis is designed properly to allow the patient to be able to clean around them properly. Lack of cleaning can cause issues. Now, this is a horrible example, well, a great example of something horrible that can happen. I had a patient come to my office literally about 6 months ago complaining about pain. We took a 3D scan, and I just took a little snapshot right here. Her prosthesis had 2 failed implants in there, and so the 3D scan showed a very dark, dark area, what we call radiolucency, meaning infected bone around this implant. Now, the story around this was that this patient had this all on 5, all on X, all on 4. Like, well, in this case, they placed 5 implants, a hybrid prosthesis with titanium with acrylic on top of it. And you could see here, all this black area is the bone loss that's occurred. So you could see the pus that was on this implant. When we unscrewed the prosthesis, the implant came right out with it. And then this patient also then lost another implant. So the background on this story was that this patient had this prosthesis, like the implants and the prosthesis loaded about over 10 years ago, and had this one cleaning over that whole period of time. Had the procedure done in Houston, I believe. She said that her surgeon was no longer practicing, and then found me, and then this is what I found, and so unfortunately she lost 2 of those implants. So you definitely want to make sure that you really emphasize to the patients that they really need to get their prosthesis cleaned. And here at our practice, we recommend they do it at least twice a year. Minimum 1 time a year, but at least twice a year. Now, prosthetic complications. Now, I just finished talking about implant complications. Again, to reiterate, those are the foundational issues. Now, let's talk about prosthetic complications. I created a video called All-on-4 Zirconia or PMMA prosthesis options. So definitely please watch that. That tells you a lot about the different types of materials, like the options that you have for All-on-4. We spoke about the foundational issues, which are the implants. Now we will discuss the issues with the house, or the prosthesis, right? So everything above ground that we can see. A complication that can occur with your prosthesis is that you develop excessive spacing between your prosthesis and your gums. This is an issue because food and bacteria are constantly going to be trapped in here, especially with an acrylic prosthesis where it's just a lot harder to keep clean versus a zirconia prosthesis. So the more that you develop bacteria underneath here, is the patient potentially going to have issues in the future, just like on that previous x-ray where that patient was experiencing a lot of bone loss. So one of the things that's really frustrating for me that I've been seeing a lot of lately is there's even a certain center down here, North Texas. I don't want to name names. I'm starting to see this especially more with the big corporate chains, multiple locations. But they're encouraging patients to get a final prosthesis a few days after your dental implants are placed, which to me is I think is lunacy. Your bone and your gum are just changing shape so much after your procedure. The remodeling that occurs, this is something we all learn in dental school, but because of that change, like the prosthesis doesn't have that really good fit months down the road, like 6 months down the road. I tell patients, imagine, shoes were made of a material that were lifelong lasting. Imagine that you had surgery on your foot and then you wanted to get a custom made orthotic on your foot for the rest of your life. You would never have surgery and then have a really swollen foot and then get custom made orthotic that you're supposed to wear for the rest of your life 3 days later. I mean, because when your foot is no longer swollen, a few months later, for example, your foot is going to be swimming in that shoe. And then just imagine all the calluses and blisters that you're going to develop on your feet and how uncomfortable it's going to be because your foot changed dimensions so much. Then 6 months later, your surgeon will then say, hey, let's get a custom made foot shoe at this point because now your foot is in its final dimension. So now, of course, then you wear that shoe for the rest of your life and it would be fine. But that's one complication that I see a lot of where patients are being encouraged, in my opinion, because it's kind of like a one and done. Hey, we are a corporate center. We're going to take care of you, move you on out of the way. We're one and done with you. And so to me, that I just see basically people are just kind of like trying to go through patients and not really be looking out for their best long-term interests by putting them in their final prosthesis way too soon. Any sort of PMMA, again, polymethyl methacrylate, otherwise known as acrylic or plastic prosthesis, will suffer from staining and breaking. So a lot of patients really get frustrated by it. I think what happens for a lot of these patients is that they get drawn to the low price and they are not happy about the shape of their teeth, and so they immediately want to just be like, hey, you know what, I've seen those photos. Let me give you a quick example of that. They see like what you did for that patient, or they see what you did for this patient, and so they're like, hey, you know what, like let's do something like that for me, and they get so excited and they get drawn into like the really cheap bait and switch price of the acrylic temporary prosthesis for $12,500 or $13,000 or $15,000. And what they don't realize is all the issues that start occurring with it, whether the teeth break off or the staining. And so we have some patients that have the titanium fused to acrylic prosthesis, the hybrid prostheses, and they're not happy about the staining. They're not happy about the teeth wearing down. They're not happy about the teeth breaking off. These are all complications that weren't addressed to the patient of things that potentially could happen. Let's talk about roofing on a house, or we could be talking about, hey, I really love that type of like roofing material, or I love the way it looks. Well, what are some of the complications here in North Texas if we experience hail? What would happen? What about that countertop? I love that countertop. That looks great. That would look great on my island. But are there staining issues if you spill a little bit of wine on there? So these are some of the questions that you have to ask yourself. Here we have a quick example, the titanium fused to acrylic. This is a hybrid prosthesis, so you can see that staining that's occurring. The teeth broke off on this patient. I just found this from the internet. I don't know who this patient is. Here's another example. To me, again, I don't know. I just found this off the internet. The tooth broke off the underlying titanium substructure. Look at how inflamed this tissue is. Who knows what's going on with the x-rays with bone loss, right? So here at North Texas Dental Surgery, we don't even offer any sort of acrylic prosthesis other than the initial temporary that you have to wear during the first 4 months. Just because we see patients have complications, and we're not having patients invest in a life-changing procedure if you start having problems 6 months down the road. You can replace the acrylic and have new teeth and gums set on the titanium bar. It'll typically cost approximately $2,500 to $4,000, depending on who you go to. One thing to consider is if this happens, then do you have another temporary converted denture so you can wear while they are upgrading your prosthesis? So what I'm talking about is that, like I said earlier, when we do the surgery, you're going home with this converted set. This is your temporary, right? So, 5 6 months later on down the road, when you're on your final zirconia set, or, your final set, whatever dental office you go to, imagine you had a hybrid with the titanium substructure with the acrylic on top of it. Imagine your teeth started wearing, your teeth started staining, patient spent $17,000, $18,000 on this, and they're like, you know what, they say at least 5 to 7 years later on down the road, you need to get these teeth and the gums replaced on top of this titanium substructure. Well, here's the issue. We can't do that in your mouth. We have to unscrew your prosthesis. We could do it in the lab. That's going to take, that's like a 1 to 2 week project, right? So you're going to be without your teeth. Now, how many patients are going to be willing to not have their teeth for that period of time? So that's not a problem as long as you have your temporary denture, your temporary converted prosthesis, right? So do you still have that? Some centers give them back to you and make you sign off some paperwork. Some centers hold on to it for you. So that's another question. Well, on top of that, you're going to have to then invest another $2,500 to $4,000. And then are you going to do this like twice a year or twice every 15 years? Are you going to experience sustaining issues? Again, Acrylic has a tendency to attract more bacteria. Are you going to develop issues underneath the prosthesis near the gums? Are you going to develop periimplantitis? Have dental implant issues? So these are some of the factors that I really don't like about acrylic. Also, another thing to think about is if you invested, like let's say $18,000 on that hybrid prosthesis with the titanium and the acrylic on top of it, now at a certain point they say, you know what, you're right, shoot, 5 years ago I made the wrong decision, let me do zirconia now. Well, that's another $5,000 to $7,000, depending again on where you go to. You know, and I honestly think that that price is closer to $7,000 at a lot of centers because there's a lot of work that has to go into it at that point also. So $7,000, were you better off just paying that from the beginning? So that's a question that you have to consider. Zirconia is a great prosthesis. The teeth won't fracture off. There will be no staining. There will be no wear over time. It again has a tendency to attract way less bacteria. However, there is one complication with zirconia. This is really the only complaint I have about zirconia, and we don't see it very often. The cylinders where the implant is attached to the prosthesis can become debonded. So then if that happens, we're going to actually have to take your prosthesis off and then rebond that. So not a big deal. It's pretty quick and easy, but just letting you know that is something that could potentially happen. So let me show you a photo here real quick. So I pulled this off the internet. This is zirconia prosthesis. This cylinder can actually be debonded from this whole prosthesis. So very rare that I see that, but just letting you know that that is the one downside that I ever see about zirconia. Other than that, I cannot say anything bad about zirconia. It is just the way you got to go within your mouth. So basically that sums up everything about the complications for an all-on-4. So knowing that you can have issues with your foundation, the dental implants within your bone and gum, and also the house aspect, everything above ground, which is your prosthesis. You know, it's very important that you pick the right prosthesis, which is why we only offer zirconia here, because we don't want you to have those complications. Let's be honest, if you have complications, you're going to be upset. You're not going to be happy. You're going to be upset about why wasn't I told about the other options. But the more complications that you have, the more frustrated you are when you come into the office. You're going to call us that same day, be like, hey, you know, my tooth broke off at 8 o'clock last night. I was having dinner and it just broke off and now I see some metal. What's going on? We don't want calls like that, because now we have a frustrated patient calling us at 8 o'clock the next morning trying to come in when we're already like, really booked out. So it creates problems for you and for us. And again, me as a provider, I am very detail oriented. I like to know about all the things that can go wrong. I want to know, again, like are all the things that can go wrong, and how can we plan to avoid all these things that are possibly avoidable. So, when we do all-on-4, I mean, we are doing a procedure within your body that your body can just, I could do everything, right? And your body sometimes just doesn't heal properly, right? And so what that really forces upon me, I went to residency for 3 years, been practicing for 10 years. I can tell a patient not to smoke after a procedure, or to control their diet, or not to do this, or chew like hard foods. So, knowing that there can be discrepancies with patient habits and what they do after a procedure, and just again, how naturally everybody heals, we have to do the best that we really can in regards to planning your surgeries and making sure not only that the dental implants don't have any issues, but again, making sure your prosthesis doesn't have issues. So knowing that, my best advice to you is just, these are some of the questions that you should be prepared to ask about when they are recommending. And now also, if these are questions that you don't ask, is your surgeon or dentist going to be very upfront and tell you about some of the issues that you might potentially have if you go with this prosthesis or if you go with these implants. So hopefully you guys found this information to be helpful. I'm really excited that you guys are looking at all-on-4, because I tell patients, all-on-4 did to the dentistry what Uber did to the taxi industry. It is revolutionary. I love it. I ended up placing 6 implants in my dad's upper jaw. I wish I did all-on-4 on him. I just did not know. He's a physician up in Ohio, 73 years old. I had no idea over the course of 5 years that he was going to lose all his upper teeth, like slowly, one by one, literally like clockwork every year. But I wish I did all-on-4. I would have saved time, money, grief for my dad, and it probably would have looked even better if we did all-on-4. So all-on-4 is beautiful. It can be an amazing prosthesis. It can be life-changing, giving you the confidence, the ability to chew all these things, but there can be complications that can be very frustrating for a patient. So hopefully I just hope this information was helpful for you guys. If you guys did, please give me a thumbs up. I would really appreciate it, and I'll hope to come out with more content for you guys. Thank you.